Se declara abierta la sesión oficiosa.
The informal meeting of the open-ended working group on aging is called to order. It is my distinct pleasure to extend a warm welcome to our high-level panel on COVID-19 and older persons. Before proceeding further, I would like to inform the working group about the organizational arrangements for the meeting. This informal meeting is held using remote simultaneous interpretation. I kindly ask participants to be mindful of the additional difficulties experienced by interpreters when working remotely and of the increased likelihood of disruptions to the audio feed to the interpreters. Participants may select the preferred language to hear the interpretation or choose the none option to hear the original language. Participants will not be able to unmute their microphones or engage their video unless given the floor. When called upon to speak, the delegate will receive a message saying that their streaming is approved. Please press the video button appearing in that message in order to share your video and audio. If you face audio or video issues during the meeting, please use the Restart All Lines button above the hand icon. Should the problem persist, please reload your browser. It's an honor for me to chair this very special meeting and to moderate this high-level panel on such a relevant topic for all of us. We find ourselves at a moment when the entire world is confronting the devastating consequences of COVID-19. The pandemic has not only caused serious effects in the sanitary and socioeconomic sphere, exacerbating existing inequalities among persons and between countries, but it has also provoked a human rights crisis and has raised unprecedented challenges to multilateralism. This pandemic also represents a unique opportunity to reconsolidate the value of solidarity, which is essential for recovery and for the to achieve more inclusive, equitable, and resilient economies and societies. Argentina, from the start of the pandemic, has adopted an integrated approach, putting the protection of lives of people first and foremost, and designing specific measures to address the specific needs and rights of older persons, women, children, low-income workers, persons with disabilities, and vulnerable groups. While the pandemic has affected the entire population of the world, it has had a disproportionate impact on the lives of older persons. The harsh reality of this crisis has bared the age-based discrimination and the lack of social protection and access to healthcare services, a lack of autonomy, and the lack of participation of older people in decision-making process. It has also demonstrated the increase in violence, abandonment, and abuse that older persons suffer. The pandemic has highlighted the plight of the most vulnerable. It has shown what in the past was invisible. It has highlighted the gaps in the protection of human rights of older persons. In line with the World Health Organization, on the 1st of March of 2021, in other words, the 1st of March of this month, 71% of people who had lost their lives due to COVID-19 were persons older than 65. In other words, 7 out of 10, every 10 deaths due to COVID-19 that have been reported have been of people who are older than 65. On the 22nd of March of this month, 85% of women who had lost their lives due to COVID-19 were older adults, and 70% of the men who lost their lives due to this disease were men older than 65 or more. Today, access to vaccines that save lives is a central feature in the path towards recovery. The vaccines cannot be a business. My country reiterates its commitment to any initiative aimed at facilitating universal equitable access to medication, treatments, vaccines, and other sanitary technologies, on the understanding that all of these are global public goods. Vaccines must be a global public good. Bearing this in mind, it is essential that the measures and policies adopted and implemented in the post-pandemic period are guided by a human rights approach, putting older persons at the center, and based on the roadmap of the Sustainable Development Goals of the 2030 Agenda. The greatest commitment of the 2030 Agenda of leaving no one behind forces us to step up our efforts so that the full exercise of their rights by all older people should be guaranteed by all states in order to move towards more just, inclusive, resilient, and egalitarian society. So what I propose is that we hear the various speakers of this high-level panel, which is extremely important, and I am hoping for a very fruitful exchange of views which will make it possible to analyze existing and future challenges to move towards the full enjoyment of human rights by all older persons. It's a great honor for me to welcome our various distinguished panelists. Her Excellency Mrs. Ana Mendes Godinho, Minister of Labor, Solidarity and Social Security of Portugal. Her Excellency Dr. Monica Roque, Secretary General of Human Rights, Community, Gerontology, Gender and Care Policies of the National Institute of Social Services for the Retired Persons and Pensioners of Argentina. Mrs. Claudia Mahler, Independent Expert on the Enjoyment of All Human Rights by Older Persons. I now give the floor to Her Excellency Ana Mendes Godinho, Minister of Labor, Solidarity and Social Security of Portugal. You have the floor, madam.
Hola a todos de Portugal.
Hello.
Here, Ambassador Maria del Carmen Squef. It's an honor to be with you, even if virtually, but we hopefully will be together soon in person. I hope to meet you in person. Well, ladies and gentlemen, dear colleagues, first of all, let me thank you and congratulate you for the open-handed working group and what you've been done, and for the contribution to put aging as a priority on the international and national agendas. It is an honor to address to you today on behalf of Portugal and on a topic that has so dramatically impacted all of us, our society, and that was one of our central concerns in Portugal during the pandemic. The pandemic, it's obvious, reinforced situations of sickness, of loneliness, of people abandoned, so many times associated with aging and older persons, even namely in terms of mental health. During last year, older people faced enormous challenges. COVID-19 changed older people's daily routines, the care and support they received, their ability to stay socially connected, and it introduced a new fear in their lives, affecting both their physical and their mental health. And knowing that older people living in nursing homes or long-term care facilities were one of the most vulnerable groups in Portugal, we devoted a special program, integrated program, to protect people in nursing homes. In fact, we did this with all the stakeholders, and we have reached one of the lowest mortality rates in long-term care facilities in Europe. Around 27% of the deaths of COVID-19 in Portugal were of residents in our nursing homes, which is one of the lowest rates worldwide. There's some.
Could the chair please mute your mic? Could the chair please mute her mic?
Look to our older people, we implemented a set of different measures, most of them involving a close cooperation between the social security system, the national health system, municipalities, civil protection, academia, and Portuguese research centers, as well as social economy entities and civil society organizations. So this was the key to this program, to bring everyone together to work together to articulate and have articulated answers, addressing and working together. In Portugal, besides fighting the pandemic and with the aim of saving lives, the government priority was given to this implementation of specific measures to address specific needs of elderly. We developed essentially measures targeting four main areas: prevention, information, training, and also guaranteeing preventive testing to identify the problem. This program included several measures, namely, I could give you some examples, but some distribution of personal protective equipment, teams that were visiting everyone to see if there were problems, or training sessions of prevention, of even a creation of a telephone hotline so that people could call to identify that they were in a situation of risk. At the same time, we created a special program who placed more than 17,000 people extra just working in the social area to work with elderly people between April 2020 and March 2021. We also promoted a national volunteer campaign to gather volunteers to help us to take care and to answer the elderly needs. Of course, and more recently, we took up a vaccination program addressed to older people, as they were our main priority to protect in the first group of priorities of vaccination. And right now we have everyone in the nursing homes completely vaccinated, so completely, at least with a higher protection. At the same time, we tried to highlight of course, the need to work with this coordination of sectorial areas, namely between health and social care sectors, ensuring that the measures could effectively respond to the specific needs and rights of all citizens, including the most vulnerable. Also, the Portuguese presidency of the Council of the European Union has adopted a set of conclusions on the topic of aging, as you know, encouraging member states to develop national strategies for mainstreaming aging. This initiative was also reinforced by the guidelines for mainstreaming adopted early this month by the United Nations Economic Commission for Europe. We need to keep on the work that we have been doing, and the pandemic must accelerate this investment and changes. We cannot let the economic and social impacts of the pandemic affect our health systems and our economies and jeopardize all the work we've been doing in the last decades towards development and sustainability. In our National Recovery Plan, we identify exactly the need to have and to develop a longevity program as a priority, addressing the situation of older people and push for adequate social responses. Parallel to emergency measures, we've been answering with structural measures, namely through the increase of the minimum amount of pensions, a digital program to include older people in the digital area, and also a program with teams that go all over the country to take and identify the situations of people who are vulnerable and designing concrete answers for each person. Ladies and gentlemen, in this policy debrief of the COVID-19 on older persons, the Secretary General stated that the recovery is an opportunity to set the stage for a more inclusive, equitable, and age-friendly society. So this must be our ambition and our commitment. We must build a society where age is no longer a factor of exclusion and that older people are our inspirators. I wish you a very fruitful working day. Thank you.
Excelente jornada de trabajo, muy agradecida.
Bueno, ahora para hablar, ¿cómo hago? Un minuto. Muchísimas gracias.
Thank you very much to Her Excellency Mrs. Ana Mendez Godinho for her statement. Now I will give the floor to Her Excellency Monica Roque, Secretary General of Human Rights, Community Gerontology, Gender and Care Policies of the National Institute of Social Services for Retired Persons and Pensioners of Argentina. Monica, you have the floor. Thank you.
Bueno, permítanme, en primer lugar,
Good morning. Thank you. I wish to thank you, Madam Chair, for your invitation and congratulate you on your excellent work yesterday and today. I wish to say that I'm deeply honoured to be among this panel with the Minister of Labour of Portugal and with independent experts. I wish to deliver a presentation. Just give me a second. I'm going to share with you a presentation. We in Argentina, well, I form part of the National Institute for Services for Older Persons, PAMI. It's the largest service for older persons in Argentina. It had 5 million affiliated to it. 90% of these are elder persons because it's actually a broader healthcare institute. As the chairperson referred to, we have this committee, and the president and the vice president of the republic are at the helm of this committee. And from the earliest point in the pandemic, the older persons have been our priority. That's been key in this healthcare initiative. Indeed, our priority has always been the care of elder persons. This pandemic has laid bare the inequality that older persons throughout the world suffer from, and that is true also in the Latin American region. We've seen society at its most merciless when a number of countries stated brazenly that hospital beds and ventilators would only be used for younger people. We are witnessing the loss of an entire generation, those older than 80 years, given that the death rate among this group is 5 times higher than elsewhere. More than 95% of those that died from COVID in Europe were older than 60 years. In countries of the Latin American and Caribbean region, 70 to 90% of COVID deaths were in this age group. The death rate of older persons in Spain was so high that in Madrid it is predicted that 1.9 years of a male's life expectancy will be shaved off the current average. 1.6 years will be lost for women as a result of the pandemic. This would bring the city back to 2009 levels in terms of death rates. In other words, this pandemic has seen the loss of healthcare and social gains won over the last 11 years. ECLAC has stated that for countries in the region, the region of Latin America and the Caribbean, the loss of such gains could range from 1 year with a prevalence of COVID at 10% or 5 years when the COVID rate was at 50%, and that could undo social gains at a rate of 20%. Now, poverty and inequality are the highest factors in the death rate of COVID. We need to tackle inequalities. There's no pandemic, COVID or any other type of pandemic, that we can really deal with if we don't deal with the pandemic of inequalities. And this is particularly true for the Latin American and Caribbean continent because we're the most unequal continent in the world. The 26 richest people in the world have as much wealth as that possessed by half of the global population. 30% of the Latin American and Caribbean population is poor, and it is expected that as a result of the pandemic, the number of people in poverty will increase to 37%. This year we'll have 45.5 million additional poor people than we previously did. Poverty among older persons stands at 30%, but we have major inequality among countries in the region. There are countries where 50% of older persons are in a situation of poverty, like Guatemala and Honduras, and Guatemala and other countries, and there are other countries in the region, such as Chile, Uruguay, where there's only 10% of older persons living in poverty. It's very difficult to implement healthcare measures. There's a lack of water, drinking water that is, fragile housing, the impossibility of physical isolation. All of these factors mean that older persons are at greater risk of becoming infected and dying. It's not true that the pandemic equally affects all age groups or that we're all in the same boat. Older persons are in much more fragile situations and are often left to their own fate. Older persons suffer more. Another factor which worsens the pandemic is a lack of investment in healthcare systems. The average for Latin America in terms of spending on the healthcare sector is 3.7% of GDP. That's very far from the recommendation of the WHO. WHO recommends that 6% of GDP be spent on healthcare, and we also have inequalities in the region because we have countries where, like Peru, where there's 3.3% of GDP being invested in healthcare, but Argentina, for example, invests around 6%. So we currently lack a system of free universal healthcare for all across our continent. Something else that makes the pandemic more serious is the lack of healthcare personnel. The number of medical officials for every 10,000 persons varies a great deal across the continent. It's quite low overall, but in Guatemala we have one nurse every 10,000 people, for example. We have other countries where there are much more healthcare personnel per person. Argentina and Uruguay, for example, have around 40 per 10,000 people, and in Cuba that number's even higher. But in addition to a lack of healthcare personnel, we have to also understand that persons in many countries, healthcare personnel are becoming ill and dying. On an average, it's estimated that 20% of healthcare personnel have become infected within a month. In Spain, that was 24%. In Italy, that was 20%. It's true that those that are most likely to get ill among healthcare personnel are women, and so there is a gender bias here. Another of the factors making the pandemic worse is a lack of investment in long-term care services. Average GDP attribution to long-term healthcare services is 1%, but there's great variation. Countries like Sweden invest about 3.5% of the GDP in this budget line, and countries like Estonia, Greece invest only 0.3% of their GDP here. However, in the Latin American and Caribbean region, this investment is practically inexistent. It's estimated that 0.01% of the GDP is invested in long-term care systems. Another of the factors that has deeply worsened the pandemic is the digital divide. This has had a particularly serious impact on lockdown and the way lockdown was experienced by all, in particular the way older persons experienced lockdown within the pandemic. In 2019, 87% of people in developed nations used the internet, and only 19% of people in LDCs used the internet. In 2015, 54% of the population in Latin America had access to the internet, and that was far lower than internet use in other countries. However, in other countries within Latin America, there's a great digital divide. The internet use among people between 15 and 29 years of age in El Salvador and Honduras is 7 times higher than that among older persons. In Argentina, we've made a great deal of progress in terms of internet access among older persons, but we still haven't reached 50% as the number of older persons with access to the internet. We do have the Inter-American Convention on the Protection of Older Persons' Human Rights, and that's been our guiding light. It's very important as a convention in all countries. Argentina has acceded to that convention, and we've ratified it also. And this convention has made it easier for us to think about how to strengthen human rights as a whole. As our government stated, we have as our priority the care of older persons, and this convention's helping us protecting those human rights. But we can look at the convention and look at the rights listed among it, and look at how many of these rights have suffered as a result of the pandemic. There is, for example, Article 5 in this convention, the right to inequality and non-discrimination on the basis of age. That's Article 5 of the convention, but we can see that that right's been eroded as a result of the pandemic. Recent reports have shown how there has been a very high death rate among older persons that were living in long-term care homes or in long-term care facilities. For example, among all of the deaths that occurred in Belgium, 57% were deaths among persons living in long-term care facilities. They were not provided with hospital care to the extent that they required that care, and they didn't receive proper medical care. 75% of all COVID deaths in Australia occurred among older persons. 43% of all COVID deaths were among older persons, and 75% of those deaths were in long-term care facilities. As was quite clearly stated by our ambassador, we've seen a loss of autonomy among older persons. There was a compulsory lockdown simply on the basis of age, and that violated their right to autonomy. And this perpetuated this idea that older persons were simply vulnerable and nothing more. But we have to talk about the fact that many older persons are healthcare personnel. There are people that have saved lives, and they continue to save lives. Many older persons are vice presidents, chairwomen of boards. There's not simply one type of old age or one type of vulnerable group, and that is also something that we should bear in mind. We should bear in mind that the major contribution that elderly persons have made to the pandemic. There's the idea, and this is enshrined in Article 9 of the Convention, that is the right to security, the right to a life free of violence, and we must bear in mind that many older persons live with the perpetrator of violence waged against them. There's institutional violence. There's the forced. There's cruel punishment that's been perpetrated against older persons in care facilities. That's prohibited by the Convention. Now, to talk about a number of measures that PAMI has put forward to help older persons, we've provided free medication for all chronic illnesses affiliated to our group. That's 5 million people that have benefited from that measure. We have electronic prescriptions so that older persons didn't have to leave home for medical reasons. They've been supported by telemedicine. We have PAMI, the PAMI community. We provide virtual recreational activities, physical activities, all of these provided virtually. We have volunteers that support older persons in a situation of lockdown. In terms of the of healthcare facilities, we opened 2 new hospitals, 4 centres for light COVID. When there was no we have many people that lacked hospital beds or ventilators across Latin America, but we ensured that all people could access hospital beds or ventilators on an equal footing. We had home checkups, we had recreational facilities provided to all in the context of the pandemic. And again, these home checkups meant that they didn't have to leave home unnecessarily and get worse unnecessarily. And we have one program that's been a major priority, and this was confirmed by our president. We have 572 long-term care facilities, 22,000 older persons live here, and since the very beginning of the pandemic, we ushered in protocols so that we were able to care for older persons so that we could provide them with all types of care. We created an expert committee for the care of older persons in residential facilities. Significant financing was attributed to healthcare facilities so that they could buy protective equipment and buy everything they needed to care for older persons, and we established a good treatment protocol to avoid abuse. We had a holistic medical approach. We had a red code adopted so that people that had even the slightest of symptoms could call a hotline and rapidly go into healthcare facilities. We had epidemiological support provided, psychosocial support, medical assistance, and training provided to families, those that had to be in lockdown, those that had to be in residences, and we had support provided to those working in facilities so that they could properly help those in their care. Of course, we greatly regret any deaths, but we can say that we have achieved results because all of the people affiliated to PAMI that became affected, only 3.9% of those that were living in our long-term care facilities, and of all of the people affiliated to PAMI that died, only 4.9% of those were living in long-term PAMI care facilities, and that's those numbers are far better than those issued in reports produced by Spain, for example. Those reports stated that 47% of those that died in Spain's first wave were in long-term care facilities. In the United Kingdom, that statistic was 45%, in France 46%, in Belgium 61%, in Canada 80%. And in the last report released in January 2021, it was noted that in 21 countries, these were 21 European countries, these rates previously cited have reduced, but 41% of deaths still occur among older persons in long-term care facilities. In European Union, 41% of deaths were among long-term care facility residents. This is an important statistic because we must bear in mind that no one can simply be abandoned in a long-term care facility. Everyone must receive care. Now, my final thought would be that everyone has the same value in the face of life and death. Human rights must be guaranteed for everybody. Quite frankly, I've seen that a number of countries did say that there was a need for this convention to protect the rights of older persons, and I'm delighted at that. We have that convention, and it enshrines 26 rights that are protected. We'd like that convention to be used. That is the convention, the Inter-American Convention on the Rights of Older Persons. We'd like that convention to be used as a roadmap. The time has come for us to do that. The time has come for us to write new rules and to really uphold a universal convention which protects the rights of all, and particularly of older persons. Many thanks.
Muchas gracias a la doctora.
Thank you to Dr. Monica Roque for her statement. And now I'd like to give the floor to Ms. Claudia Mahler, independent expert on the enjoyment of all human rights by older persons.
Thank you, Madam Chair. Do you hear me? Hello? Do you hear me now? Okay, perfect. Thank you, Madam Chair, Presidents, Excellencies, ladies and gentlemen, for giving me the floor. It is a great pleasure to be with you today and to address you remotely from Berlin at this 11th session of the Economic Working Group for the first time in my capacity as independent expert on the enjoyment of all human rights by older persons. First of all, I want to thank the members of the Bureau, chaired by the government of Argentina, and vice chairs Philippines, Slovenia, Portugal, and the rapporteur of the Bureau, Ghana, for the kind invitation to address the high-level panel on COVID-19. I'm grateful that your hard work has made it possible to meet despite virtually a reality. I'm pleased to address all of you during these difficult times. Almost 1 year after I assumed my position as independent expert in May 2020, 2 months after the global crisis was no longer just a threat, but an unavoidable reality. At the outset, allow me to pay tribute to my predecessor, Rosa Konfeld-Matte. I wish to acknowledge her path-breaking work in advancing the human rights of older persons during her tenure as the first independent expert on the rights of older persons. I had the honor to present for the very first time a dedicated thematic report to the General Assembly on the impact of the coronavirus disease COVID-19 on the enjoyment of all human rights by older persons, A/75/205. While the disease spread among persons of all ages, older persons and those with underlying conditions are at higher risk of serious illness and death from COVID-19. The pandemic has had and continues to have a disproportionate impact on older persons and has magnified existing violations of their rights. Older persons were denied health services, care and support. They were physically and socially isolated, and they were victims of ageist attitudes. Despite being such a diverse group, older persons in generally have been labeled as vulnerable and branded as burdens to society. In my report, I have tried to highlight that older persons play an active role in societies and are already being part of the solution. Older persons play multiple roles in society as caregivers, volunteers, and community leaders. Women are sadly overrepresented on both the givers and recipients of care and face inequalities in many circumstances. This is the reason why I have decided to look more closely at the multiple forms of discrimination older women face in one of my thematic reports of 2021. The pandemic also made very evident the urgent need to combat stigma and age discrimination. My other thematic report in 2021 will examine the impact of ageism and age discrimination primarily on older persons, but the impact they have across generations. In this regard, I'm really grateful that WHO paved the way for a worldwide discussion on ageism with their global report launched on 18th March. The pandemic has shed light on the barriers preventing older persons from fully enjoying their human rights. It had also shown that older persons are left behind. It has made visible protection gaps, which have been highlighted by stakeholders from all over the world during the numerous intersessional meetings I attended. All these gaps will need to be addressed beyond the response and recovery stages, and the way to bridge the gaps can only be achieved if older persons are participating in the decision-making processes. The current crisis has also highlighted the need not only for urgent action from governments in response to numerous challenges, but also for preventive measures and global cooperation. Ladies and gentlemen, the COVID-19 pandemic has changed the way we do business and has highlighted the need for digital literacy as more and more information related to the virus and vaccination programs are available largely online, coupled with the need for social distancing, for teleworking, and containing the spread of the virus. Digital exclusion significantly impedes the access of older persons to essential information regarding the pandemic and related health and socioeconomic measures. Older persons who live alone in care homes in rural or remote areas or in areas lacking connectivity might have limited access to information and services distributed through new technologies because of a lack of access to devices and limited digital skills and assistance. We gained information that the digital connectivity of older persons increased. But with the acceleration of the use of online and mobile services as a result of restrictions of movement, it is essential to ensure that information, services, and networks are accessible to all older persons in terms of language, format, and easy understanding design of devices, that it is available for those with limited knowledge of and access to online services. Lifelong learning programs need to take into account digital literacy programs and support services to make information and services accessible for older persons, as well as the infrastructure required to access the internet. Older persons who are in need of support or help because of abuse or neglect have been left behind. Because of lockdowns and physical distancing measures, many older persons lived alone with their families or in institutions, did not have a chance to complain or have access to justice or could even ask for help, owing to the breakdown of the regular communication channels with their networks. At the height of the pandemic, when official monitoring in some care homes was interrupted to focus on controlling the spread of the virus, the prohibition of regular visits from friends and family removed the crucial informal monitoring mechanism and provided an entry point for violence, abuse, and neglect. The neglect of older residents has had tremendous negative outcomes, with data becoming available now. We cannot allow that this happens again. We need to ensure that older persons' human rights are sufficiently protected. The lack of disaggregated data on older persons, which was the theme of the last report to the Human Rights Council, is another manifestation and the cause of the invisibility of older persons. Giving older persons a voice will be my guiding principle in discharging the mandate the Human Rights Council entrusted to me. Ladies and gentlemen, the pandemic has highlighted the urgent need for stronger protection of the human rights of older persons who remain rights bearers until the end of their lives. Let us heed the call of the Secretary General in his policy brief on the rights of older persons and the overwhelming support of states and civil society organizations in response to the policy brief to bridge the gaps that the pandemic brought to light. The working paper submitted by the Office of the High Commissioner for Human Rights on the update to the 2012 Analytical Outcomes Study on the normative standards in international human rights law in relation to older persons is a useful tool to identify gaps and forge the way towards a binding instrument which can provide the protection that older persons not only need but deserve. Thank you very much for your attention, and I look forward to a fruitful discussion and a very successful event.
Espero que este evento tenga pleno éxito. Muchas gracias.
Muchas gracias.
Many thanks indeed. Many thanks to you, Ms. Claudia Mala, for that briefing. Very briefly, if I may. I'm just going to attempt to issue a brief summary before I give the floor to others. We have a long, lovely list of speakers, but I'm just going to give a brief summary. Older persons, men and women, have been those most greatly affected by some stretch by the pandemic, in addition to those most likely to die. They've been most marginalized. They've been those most subject to abuse. When they needed to be able to get online to ask for help or to deal with any other form of administrative problem, that was very difficult for them. Devices weren't adapted to the needs of older persons. And something else I wanted to underscore was the efforts, the vast individual efforts undertaken on country level, and that was made very clear by the presentation given to us by Ms. Roque and many of the presentations we received yesterday. You do have to follow the whole session, because otherwise you can't get a full picture of what's happening at country level. Individual countries have made Herculean efforts to avoid so much death and so much isolation among older persons. With that, I'd like to give the floor to other speakers so that we can see how the United Nations, in addition to COVAX, might contribute to improving work on this front. We issue recommendations. We endeavour to make these brief and tangible. I'd ask you to make your statements brief and tangible. 5 minutes if you're speaking on behalf of a group of states, 3 if you're speaking individually. Participants are requested, when wishing to make use of the floor, please, they're asked to click on the inscription form. That request is published, and that means that we can give you the floor. Please follow that procedure. Something else that was reminded to us by the Secretariat is that participants can't activate their video or their microphone if they're not given the floor. If they're given the floor, they will see a sign that says that their intervention has been approved. They can then press their video button. If you have any technical difficulty in activating your microphone or your video, once your speaking request has been approved, we'll get back to you and try and assist you at a later moment. I now give the floor to Fatima. Rabat, you have the floor. Thank you.
Thank you. Thank you very much, Madam Chair. Thank you, Madam Chair, for your excellent leadership in this difficult time and for convening this important meeting. I also thank the distinguished panelists for their insightful remarks. This has been a very rich discussion. Let me begin by paying my condolences for the sad loss of the elderly people to the COVID-19 pandemic. Indeed, the impact of the pandemic for the elderly has been particularly devastating, accounting for a disproportionately staggering number of COVID casualties worldwide. They're also suffering from abuse, isolation, trauma, discrimination, as previous speakers have very eloquently shared. And as we build back better for the pandemic, we must ensure that older people are treated with dignity and their rights are protected. Madam Chair, the situation of the aged in Bangladesh in the pandemic has also been hard. They accounted for nearly 50% of the COVID-related deaths. They have also been affected by poverty as they are mostly dependent on the incomes of their children. We have made efforts to mitigate the situation of this group of population. During the pandemic lockdown, the national helpline 333 was repurposed to enable millions of people access medical and other life-saving services, which was of great help to the aging population. The elderly people are also receiving COVID vaccine on a priority basis. The government has rolled out extensive COVID recovery stimulus packages. Food and cash grants are also being provided, including to the elderly, especially those who are living in poverty and in distressed situations among them. We have fairly comprehensive and strong national policies, such as the National Social Welfare Policy, the National Policy on Aging, maintenance of the Parents Act, and the National Social Security Strategy for the welfare of the aged population. Since 2001, we have introduced old age allowance targeted to the poor and vulnerable segment of the older population, with special provisions for elderly women, including widows and those abandoned by their families. Respect for and ensuring the welfare of the elderly is deeply entrenched in our socio-cultural fabric and extended family system. However, as families gradually turn nuclear, the elderly are facing an unfamiliar and uncertain situation. Recognizing this new reality, facilities and old age homes are being set up with extended healthcare and medical services. Obviously, there's more to be done, and in our endeavors, we are also reaching out to the private sector. The pandemic crisis has also revealed the gaps and the need for strengthening further the social safety net programs for the aged. Madam Chair, now turning briefly to the global situation and response to the older population in this pandemic, we all agree that there is certainly much more that can be done. We thank the Secretary General for his policy brief on impacts of the COVID on older persons, which was a very timely initiative. Aging is a cross-cutting issue in Agenda 2030 with linkages among the various SDGs like Goal 1, Goal 3, Goal 5, or Goal 10. It is imperative to integrate the older people in our common strategy, which is Agenda 2030. Allow me now, Madam Chair, to briefly share some thoughts in this regard. Firstly, the elderly population must be integrated in our response and recovery efforts. We could greatly benefit from their knowledge, experience, and perspectives to build back better from this crisis. Secondly, governments must make sure that the elderly population have access to adequate social protection measures. We must ensure an enabling environment for them to enjoy fully their human rights. Ensuring digital connectivity for them could also mitigate this situation. The private sector and the civil society must also join hands to address the needs of the older persons. Third, we must remember that no one is expendable in the pandemic. The elderly population are equally, if not more, entitled to health service and COVID vaccines and should be provided with healthcare without any exception. In fact, they must also receive priority attention relating to their social and psychological needs. We have seen shameful manifestation of neglect for the elderly during the pandemic, especially in getting healthcare. Finally, Madam Chair, while the Madrid International Plan of Action and the Political Declaration of 2002 continue to remain guiding principles for enhancing promotion and protection of the human rights and dignity of older persons, it is time to redouble our efforts and be very sincere towards concluding a multilateral legal instrument covering all aspects of the human rights and well-being of the older persons. Bangladesh will strongly support and constructively engage in that process. I wish to conclude, Madam Chair, by reiterating our commitment to ensure a dignified, inclusive, and equitable world for our elderly population. They are very precious. I thank you, Madam Chair.
Many thanks indeed to the distinguished representative of Bangladesh for her statement. Many thanks indeed. We now give the floor to the representative of China, Qiao Roisang.
Thank you, Madam Chair. Thank you very much for holding this very important meeting. COVID-19 has dealt a severe blow to older persons, and the whole society needs to mobilize to actively taking care of them. I would like to focus on the following 2 points. First, protecting the rights to life and health of older persons is fundamental. Older persons are more vulnerable during the pandemic. Governments of all countries should ensure their health and safety so that none of them will be left behind. The Chinese government has committed to put people and their lives first and has provided in-hospital or other forms of treatment to elderly patients as much as possible. No matter how old they are or how serious their conditions, we'll never give up on them. In Hubei province, where the pandemic hit the hardest, the success rate of treatment for people older than 80 reached about 70%, with a total of nearly 4,000 cured. The oldest among them has reached the age of 108. In March last year, a doctor from medical team came to Hubei to help and made a stop on the way while bringing an 87-year-old patient in for a medical exam to allow the older patient more time to see the sunset he long missed. Many people are touched by this episode of caring for people's life, value, and dignity. Second, attention.
Excuse me, 1 minute, 1 minute. It's not translation at the moment. Please, the secretariat, listen to me. Listen, the secretariat.
Yes.
Because it's checking what happened with the interpretation.
Thank you very much,
Thank
Madam
you
Chair.
very much.
Madam Chair, this is Juana speaking. Our conference officers are looking into this. It appears that the Spanish interpretation is affected. All other channels seem to be working. Madam Chair, I'm getting confirmation that there should be Spanish interpretation now.
Señora Presidenta, se me confirma que ahora debe haber interpretación
Okay.
al español.
Okay.
So may I
Muchas
continue
gracias.
now?
We can continue.
Sí,
It's
podemos
possible.
continuar.
It's possible to start again.
Yes, no problem.
Thank you. Thank you very
Madam
much.
Chair.
Thank you, my dear.
Gracias.
Thank you. I'll start again with Chinese, and thank you again, Madam Chair.
Madam Chair, first of all, I would like to thank the panelists for their introductions. Their experience is very enlightening to us. COVID-19 pandemic has dealt a severe blow to older persons, and the whole society needs to mobilize to actively respond. I want to focus on the following 2 points. First, protecting the rights to life and health of older persons is fundamental. Older persons are more vulnerable during the pandemic. Governments of all countries should ensure their health and safety so that none of them will be left behind. The Chinese government has committed to put people and their lives first and has provided in-hospital or other forms of treatment to elderly patients as much as possible, no matter how old they are or how serious their conditions. We will never give up on them. In Hubei province, where the pandemic hit the hardest, the success rate of treatment for people older than 80 years has reached about 70%, with a total nearly 4,000 cured. The oldest among them has reached the age of 108. In March last year, a doctor from a medical team coming to Hubei to help made a stop on the way when bringing an 87-year-old patient in for medical exam to allow the elderly patient more time to see the sunset he long missed. Many people are touched by this episode of caring for people's life, value, and dignity. Second, attention should be paid to the needs of older persons. Their quality of life should be continuously improved during and after the pandemic. Governments should listen to the voices, suggestions, and ideas of older persons, eliminate discrimination and violence against them, and use post-pandemic recovery as an opportunity to build a more inclusive society friendly to older persons. A more equitable and sustainable social security system must be built to eliminate the concerns of older persons. I also agree with what's been said by Ms. Claudia Locchia, that it is necessary to effectively resolve the difficulties that older persons encounter when using smart technology in their daily lives, such as for travel, medical treatment, and consumption. Targeted assistance should be provided to the very old living alone and with disabilities so that they are properly taken care of and no one is left behind. Madam Chair, respecting old persons is a traditional virtue of China, while loving and helping them is the shared responsibility of the whole society. China is ready to work with the other countries to properly handle the new challenges in the fight against the pandemic and in post-pandemic recovery so that no older person is left behind. Thank you, Madam.
Muchísimas gracias.
Thank you to the distinguished delegate of China. Now we're going to give the floor to the representative of Argentina, Mr. Alejandro Rubino. Thank you, Madam Chair. Good morning. Unfortunately, the sound is very poor. I'm sorry. The sound is inadequate for interpretation.
Argentina es un país que ha logrado una cobertura de casi el 97% de la población en condiciones de acceder a una jubilación o a una pensión. En contexto de pandemia, el Estado Nacional Argentino ha dado máxima prioridad a la atención de las personas mayores. En este sentido, cabe destacar que la Convención Interamericana sobre la Protección de Derechos Humanos de las Personas Mayores ha sido aprobada y ratificada en mi país a través de la Ley 27.360. Este Tratado de Derechos Humanos es vinculante y específico y representa un instrumento jurídico sumamente valioso para garantizar todos los derechos humanos de las personas de 60 y más años de edad. Esta pandemia demuestra los desafíos que enfrentan las sociedades de todo el mundo y principalmente la necesidad de generar marcos legales internacionales eficaces referentes a la promoción y a la protección de los derechos humanos de las personas de edad. Hoy, el Plan de Acción Internacional de Madrid sobre envejecimiento resulta insuficiente, puesto que el mismo no constituye o no tiene carácter de vinculante. En este sentido, se exhorta a los demás estados para lograr una convención internacional que salvaguarde los derechos humanos y libertades fundamentales de las personas mayores, y además que permita combatir la discriminación por edad y hacer sostenible la construcción de una sociedad para todas las edades. Finalmente, resulta de interés consultar a la señora ministra de Portugal si piensa que Europa podría adherir en este contexto a la construcción de una convención universal sobre la protección de los derechos humanos de la personalidad. Muchas gracias.
Muchísimas gracias al representante de Argentina.
Thank you to the representative of Argentina. Now we'll give the floor to the representative of Mexico.
Buenos días, ¿sí me escucho?
Good morning. Can you hear me? Yeah? Okay. Good. Thank you very much to the Madam Chair for guiding this session, and also to the panelists, Monica Roque, who I know very well, and I'd like to tell you how Mexico is dealing with the pandemic. Our information is our data is very different compared to other Latin American countries in terms of mortality of older people. And I wanted to just stress something regarding some of the news that we're receiving from Europe that has helped us to design a strategy that helped us protect people in nursing homes and also people who are alone, isolated, without a support network. First of all, I'd like to just highlight what the President Lopez Obrador said at a meeting with the UN, where he requested that vaccines should be universalized, that there should be no speculation, or there shouldn't be there shouldn't be people should not be profit seeking. And we in Mexico are seeking to provide information to our entire population using every media available to strengthen all preventive measures that have been taken and have been recommended. We are also monitoring the recommendations of the Ministry of Healthcare, and of course we are also guided by the World Health Organization in terms of preventing the spread or contagion, because we don't know what kind of response older people would have in the face of being infected. Of course, the immune system of each individual and their health condition is very important. And for 40 years, there's been neglect in our healthcare system, which has had an impact on older people and younger people also in terms of comorbidity. We also have provided training, virtual training, because as many of you, we are trying to set up and streamline the virtual contacts in order to reach as many people as possible, and we're making a significant effort to stay in touch with the long-term care institutions. We in Mexico are building a network of these to have a much broader reach and to strengthen these institutions who are on the front lines of ensuring that older people's rights are protected and upheld in these institutions where they are cared for. So there's been a real reaching out with the providing of information, mapping, training, and also attempting to be constantly in touch with the health care agencies at the municipal, at the state level, again, to make sure that they provide sufficient care and to older people. I just want to also say that we haven't had the same level of mortality as in other countries, but we are trying to gather all this information in order to better understand how COVID what kind of impact it has had in these long-term care institutions, nursing home, etc. And to gather the numbers available to understand what we can do in the future and to take advantage, as every country has been doing, to really focus on older people in order to protect their rights, and how we can strengthen our institutional network so that older people receive the kind of care that the society owes them, in addition to the simple that society sees them as holders of rights and not simply as these vulnerable individuals or who are suffering. In other words, we have to really focus on how we should value older people, and we're also working on vaccination and vaccines to provide information to health institutions and to long-term care institutions to make sure that in these types of institutions a vaccination campaign is conducted. It's often very difficult to get people with the disabilities, for example, to move them around and to avoid the risk of infection. So we are seeking to coordinate at the national level to provide information and set up a single register of all these institutions, nursing homes, long-term care institutions, and to provide that information to health institutions, hospitals, etc. So thank you very much. We're very, very interested in everything that is being discussed here because it will help us strengthen public policy in the way we deal with older people. And at least for this president, even when he was the mayor of Mexico City, it was one of his top priorities. So we're very grateful for participating in this and for everything we've heard. Thank you very much. Thank you very much to the distinguished delegate of Mexico. Before we continue, I'd like to say to the Secretariat, I'm looking at the chats, and the interpreters at 10:57 said that they could not interpret because the sound was very bad. Well, for all of us here has been significant effort to be here, and for each delegation is very valuable what they're saying, and every one of them has a right to be heard. So please, I'm asking the Secretariat that, as happened with China, who had to repeat once again their statement, please monitor what's going on with the sound. Thank you very much. And now I will give the floor to the United Kingdom. Mrs. Megan White, you have the floor.
Thank you, Madam Chair. I hope everyone can hear me. I would like to express the United Kingdom's thanks to the panelists for your insight today and for all that you do in support of human rights of older persons. COVID-19 is and will continue to be an exceptional challenge. It is the biggest public health emergency of our lifetimes, and it calls for decisive and coordinated global action based on science and evidence. We know that older people can face particular issues with the virus. We know that they can be at greater risk of serious complications, including death, with global fatality rates from COVID for older persons around 5 times the average. We also know that older persons are very likely to be affected by the socioeconomic impacts. However, while we are mindful of the challenges, we know that older people play a vital role as friends and family, as caregivers and educators, as leaders and volunteers, and as a source of experience and inspiration. Our recovery from the crisis, and as we build back better, we have an opportunity to listen for that inspiration and heed that experience. We have an opportunity to think about how we support people of all ages and how we can draw on the best that our people have to offer, however young or old. The UK is committed to including age as a factor in our development programs and in all our efforts to promote a fairer world. Many of our programs already reach older people, like our work to strengthen health systems, assistive technology, and eye care. Others are specifically for them, including work on social protection. Our departments have specific guidance to include older people in COVID response activities. Equally, we welcome the fact that many institutions, including the UN, have recognized the importance of taking the needs of older persons into account in the response to COVID-19. We should carefully reflect on the Secretary General's policy brief on COVID and older persons, particularly its clear message that our response to COVID must respect the rights and dignity of older persons. Further, the working paper prepared by the Office of the High Commissioner for Human Rights in advance of this session merits careful consideration. My question to the panelists would be, how can states better work with international institutions, including the UN, to ensure that our recovery from COVID properly responds to the needs of older persons? Thank you.
Thank you to the delegate from the United Kingdom. I think you have raised a very interesting question. Now, before responding, and since we've heard a lot of interesting comments and observations, perhaps Mrs. Roque and Mrs. Mahler, unfortunately we won't be able to have the minister from Portugal in the last part of our meeting because she had to leave. So we'll close with the statement by Croatia, Simonovic Walter. I'll give you the floor, and then we will we will have the first round of answers. So, Croatia, you have the floor.
Okay. Distinguished Chair, distinguished members of the Bureau, I am speaking today as the Ombudswoman of Croatia and on behalf of ENVI, the European Network of National Human Rights Institutions. The NHRIs welcome the opportunity to speak at this important part of the session, and we would like to congratulate the Chair and all the members of the Bureau for facilitating this high-level panel on COVID-19 and older persons. The COVID-19 pandemic has put human rights to the test, like never before. As the outbreak rapidly developed, governments have taken broad and strict measures to reduce the virus spread, prevent a breakdown of healthcare systems, and save lives. Such government measures must protect the rights of all people and cannot discriminate. Their impact on the rights of particular groups, such as older persons, requires particular scrutiny to avoid older persons being disproportionately affected or discriminated against. In practice, however, European NHRIs witnessed firsthand how the COVID-19 pandemic and government measures affected the lives of older persons across the European region. As confirmed by the new WHO Global Report on Ageism, this global pandemic amplified existing ageist behavior and practices. Restrictive COVID-related measures are too often based on age, thereby limiting older persons' access to healthcare, to work, to volunteering, and even prohibiting them to take care of their own grandchildren. Such age limits are rooted in the false assumptions that all older persons are vulnerable and that they constitute a homogeneous group. Ageist stereotypes were also widespread in press coverage and social media contents regarding the pandemic. In certain instances, older persons were even blamed for the restrictive government measures, and intergenerational tensions rose. The pandemic had a grave impact on the lives of older persons in residential care settings, who not only face substantial numbers of infections and deaths, but continue to face restrictions on visits from family members, as well as restrictions on their freedom of movement outside the institution or even their own rooms. More importantly, older persons' voices were not heard. They were not adequately consulted about the far-reaching restrictions they had to endure, and in many cases not treated as full and equal participants in society. As the UN independent expert on the enjoyment of all human rights by older persons, Claudia Mahler, notes in her report, the pandemic has not only shed light on the barriers preventing older persons from fully enjoying their human rights, but has also shown that older persons are left behind. It has made very evident that there is a protection gap, and therefore an urgent need to strengthen the human rights framework for older persons. ENRI therefore firmly supports the adoption of a comprehensive binding instrument at the international level and calls the open-ended working group on aging to commence the drafting of the instrument. We can no longer allow older persons to be left behind and their voices to go unheard. Thank you.
La distinguida.
I want to thank the distinguished representative of Croatia. So now I'm going to turn the floor back to Dr. Monica Roque and Claudia Mahler if they wish to comment on this first round of interventions.
Hola, ¿qué tal?
Yes, of course. The interventions by the various delegates have been very interesting, and leads me to a number of reflections. Of course, we agree that the rights of older persons have been violated, but this has been the case for a long time. This, what has happened with COVID, has been occurring for some time. The Agenda 2030 is a roadmap that all countries of the UN have. And only 1.7 targets speak of older people. They're invisible in the 2030 agenda. and only 0.48% of indicators speak of older persons. And as we all know, what cannot be measured doesn't exist, because public policy requires the measurement of impact. If I don't have a way of measuring impact, obviously, then public policy cannot exist. So what we have to demonstrate is that that what we have seen is that the pandemic has demonstrated the systematic violation of the rights of older people. We, as a country, Argentina, has been discussing this for quite a long time, and we went to the Argentinian embassy and the Organization of American States to ask for the drafting of a convention, because we in Latin America were seeing what was happening with older people in our countries. And within the OAS we had a quick response, but within the UN we were denied the possibility of starting to work on a convention. This is why in my intervention, that's what I said. And after having listened to all the countries yesterday, I said that I think we're at a very crucial moment, because the pandemic has really revealed something that some countries didn't want to see, and that is the systematic violation of the human rights of older people. And it's both in rich and poor countries. So I think most of us who are here at this meeting, and you yourself have said this, we are convinced that we can't wait any longer. We must begin to draft a convention. And what we're proposing is, as a normative framework, to use the Inter-American Convention on the Protection of the Human Rights of Older People. Because in responding to the delegate of the United Kingdom, we must have specifically targeted policies to protect the rights of older persons, because we have seen that the Universal Declaration of older persons, who speaks of the fact that we're all equal, etc. Well, throughout history, this declaration has not really been useful. First, we needed to have the convention on the rights of children, because their rights were violated. So beyond the Universal Declaration of Human Rights, we had to have these conventions. First, a convention on the protection of rights of children, then the convention on the protection of the rights of women, because they were being violated, then the convention on the rights of persons with disability. So the time has come for a convention for older persons, because beyond simply the good intentions that we might all have, what we need is a legally binding instrument which will form the roadmap to ensure that these rights are guaranteed and upheld. That will be my contribution, my response to what some of the delegations have stated. Thank you, Dr. Roque. Madam Mahler, would you like to make a comment? Would you like to respond?
Thank you for giving me the floor, and thank all the previous speakers for their meaningful interventions. I think they all spelled out, as also yesterday delegates, that they all experienced the violation of the human rights of older persons, and therefore they are trying to achieve numerous different measures to improve the situation. And what we also have seen and learned, and what Monica Roque also just spelled out quite clearly, is that we have been missing the evidence that the human rights of older persons are at stake and not taken into account when it comes to healthcare measures in emergencies. But I think what we have witnessed through the pandemic is that the evidence is right here. And therefore, I would also like to stress once more that we also should consider the outcome and the analytical paper of OHCHR as the update of the 212 analysis, to see exactly where we need to improve the current system, because it's not sufficient to protect the human rights of older persons, which was also mentioned by the High Commissioner of Human Rights. And to answer the question of the delegate of Great Britain, I think, first of all, because this is the human rights, we are talking about the human rights of older persons, the engagement with the treaty bodies could be improved. We heard this for now a decade that it's only or we only need better implementation, but we haven't seen the improvement in this regard in the treaty body system. So therefore, we also need to ensure that the system is perfectly used. So please include all the persons in your regular reporting to the different treaty bodies, and then also implement the different conclusions and recommendations of the treaty bodies. And therefore, but after this, we also will see that many issues and rights are not perfectly addressed in the current system, and we need to improve the current system, which was also mentioned by this previous speakers yesterday, especially in the opening session. It was mentioned that we need to encourage all the states of this group to improve the situation and rely on the mandate to come up with a draft of a new convention, or with the draft of possible articles. Thank you so much, and I'm really looking forward to get more questions.
Thank you very much, Madam Mahler. I just want to make clarification. It's 11:20. We have interpretation until noon, and we have 9 interventions. So I would ask everyone, please, to really concentrate your statements and go directly to questions if you have any, to take advantage of the presence of our experts. So now we're going to give the floor to Madam Reham Al-Lahmi from Qatar.
مساء الخير.
Good morning. Can you hear me? Good afternoon. Good day. Good morning. First of all, I want to thank the chair, and I want to thank all the participants and all the speakers for the useful and important information that has been presented to us. It's a pleasure and an honor for me to take part in this session. And my statement, I want to highlight the concern of Qatar to fulfill its obligations with regard to respect for human rights. Can you hear me well? Very well. So, I would like to highlight Qatar's fulfilling its regional and international obligations. Since from the start of the pandemic, Qatar has been greatly concerned about this sanitary situation, and in particular as it affects older persons, because this category of people is particularly vulnerable. So we have provided sanitary care at home for these people. Also, a free telephone number has been set up to answer their questions and address their concerns. The medical care is free of charge for all residents of Qatar. Vaccines are free, and the Ministry of Healthcare has put together a plan consisting of 4 phases. First, vaccination for those who are older than 65 or who have chronic diseases. That was the first phase or first group. And then the Ministry of Healthcare and Social Services has also taken preventive steps and provided smartphones to older persons, says the speaker, because there are a number of services, over 30 different services that are provided virtually or remotely, in particular for older persons. Now, also, various ministries provide services virtually to avoid infection. Those who are eligible for Social Security are also have been eligible for this for these services, remote services. Regarding awareness raising, we have targeted a campaign on the older persons to avoid infection, and we have used social media and various virtual platforms. Thank you very much for your attention.
Muchísimas gracias.
Thank you very much to the representative of Qatar, and I'd like to congratulate you for the measures that you have implemented. Now we're going to give the floor to Turkey. Mrs. Barku Ayhan, you have the floor.
Thank you, Madam Chair. At the outset, I would like to thank the panelists for their informative presentations. Turkey attaches great importance to the promotion and protection of human rights of older persons, especially during the COVID-19 pandemic, which has been impacting the global population in drastic ways. Long-term care and support services are continued to be provided for older persons with a view of universal human rights approach. In Turkey, measures were adopted particularly for older persons who live in nursing homes, even before COVID-19 became widespread in the country. The visits and entrances to the nursing homes have been restricted, depending on the course of the pandemic. Training on the health and nutrition of older persons are provided. Measures have been taken to meet their needs, and essential medical and hygiene supplies have been procured to ensure older citizens have access to care and support they need during the pandemic. It has been our priority that older persons can access healthcare services during the pandemic. One of the specific measures implemented during the pandemic is social isolation care institutions, where older persons have been placed after being discharged from hospitals. Their health conditions have been observed for 14 days in those institutions. They were transferred to their own nursing homes only when we were sure of their negative test results. This way, the virus has been prevented significantly from occurring in the nursing homes in the first place, and the pandemic has been taken under control to a great extent. The staff of nursing homes has voluntarily worked in 14-day shifts, and they have been tested for COVID-19 before each work shift. Additionally, body temperature, pulse, and respiration of older persons and the employees in nursing homes have been checked every 6 hours. Guidance and advice in multiple formats for older persons and their households, health and social care workers, care facilities, and local authorities have been provided on considerations for older persons in the context of the pandemic to minimize adverse outcomes. Furthermore, older persons in Turkey have been the priority for COVID-19 vaccine. Since our cultural pattern stresses respect for older persons, some digital festivals and digital visits for older persons have been organized. To conclude, Madam Chair, beyond healthcare issues, the pandemic is putting older persons around the world at a greater risk of poverty, discrimination, and isolation. We believe that international cooperation and information exchange are crucial to better overcome the difficulties of pandemic and its effects on communities and societies. I thank you.
Muchísimas gracias a la representante de Turquía por su
Many thanks to the representative of Turkey for that statement. I now give the floor to Association for the Aged, Ms. Famada Manyan.
Quizás podemos seguir.
Perhaps we can continue now with the next speaker and then come back. Ah, no, there you are. Thank you, thank you. Ms. Yamai, we're listening to you. Thank you.
Hello, everyone. Thank you, Madam Chair. This submission is made by the Association for the Aged, or TAFTA, in Durban, South Africa, and I thank you for the opportunity to address this meeting. My presentation today focuses on the need for a global disaster management strategy to respond to the health crises that affects the older persons. TAFTA, as a non-profit organization and a residential care facility supporting the needs of approximately 5,000 to 7,000 older persons, is the largest NPO of its nature in South Africa. In March 2020, the South African government declared a national state of disaster, supported by a risk-adjusted lockdown alert level strategy to manage the spread of the COVID-19 pandemic in the country. This strategy was formulated by the National Command Council, acting as an expert advisory body to the government in consultation with various industry associations and appropriate medical experts. No consultation, however, was held with non-profit entities, particularly in the older person sector, and this was worrying, especially as older persons were defined as a vulnerable group. Yet the lockdown regulations necessitated that the sector put in place various restrictive measures to ensure COVID-19 compliance within our facilities. This included the restriction of movement to and visitation of our older persons in our care facilities. The lack of consultation extended to the lack of disaster relief funding to the sector to mitigate against COVID-19 risk. And unfortunately, the consequences of this exclusionary process has impacted on the sector's stability dramatically. This to the point of older people aggressively denouncing regulations that restricted their freedoms. In addition, a destitute nonprofit organization was forced to take legal action against the state to seek financial support. To date, no funding has been allocated to support the NPO sector, and we seek the legitimacy of a global body to establish a disaster relief response plan to guide government's consultation with the sector and to include older persons too in the decision-making processes, especially as it impacts on their rights and their freedoms in the context of a global pandemic. We support the call for a convention to protect the rights of older persons, especially the right to participate in decisions that affects their lives. Our question to the panel is, how do we ensure that a global instrument is not only legally binding, but encourages member states to report on progress in this regard with an acknowledgement and participation of all role players? Thank you very much.
Muchas gracias.
Thank you very much to Ms. Yama for that statement. Now we give the floor to Human Rights Watch, to Ms. Shen Ujanam. You have the floor.
Good day. Thank you, Madam Chair, and to all of our panelists. On behalf of Human Rights Watch, I would like to thank the panelists and to acknowledge in particular the ongoing and critical work of Claudia Mahler, the independent expert on the human rights of older persons, including her reporting on the impact of COVID-19 and the human rights of older people. The world has changed in ways we could not have imagined when we met 2 years ago. If prior to the COVID-19 pandemic, it was possible to trust that existing structures of care were enough to ensure the dignity and autonomy of all of us as we age, now it is no longer possible. If prior to the pandemic, it was possible to assume that existing human rights mechanisms would protect older people from discrimination, abuse, and injustice, now it is no longer possible. Now is the time to act. The need for a UN Convention on the Human Rights of Older Persons has never been more urgent. It can support meaningful changes in law and practice at the national level around the world. Human Rights Watch has documented the cost to older people of insufficient guarantees of their human rights during the COVID-19 pandemic, as well as before it, in multiple countries around the world. Violations of the rights to life, to the highest attainable standard of physical and mental health, to informed consent to medical treatment and medications, to private and family life, to information, to justice, to work, as well as violations of the prohibition on inhuman and degrading treatment. By way of example, we interviewed Shirley, who talked to us about her husband, Joe, in his 80s. Shirley and Joe wanted to continue their life together at home in the United States after his stroke. But the lack of accessible, affordable, community-based, and home-based supports made this impossible. Due to COVID-19, Joe spent the last months of his life in a nursing home, unable to see his wife. Shirley described their phone calls. I would ask Joe how his afternoon went, and mostly he said he makes himself sleep to pass the time. I heard him say frequently, in a really sad voice, "This is no way to live." How do we want to live as we age? Surely it is to age with rights. Surely it is with the full guarantees of all fundamental human rights, no matter our age, no matter where we live. Human Rights Watch supports the joint statement of the Global Alliance on the Rights of Older Persons and the joint statement of the National Human Rights Institutions and civil society organizations, and to the call to member states of this working group to fulfill their mandate and start drafting a UN Convention on the Rights of Older Persons. And I have a question to our panelists. As this process moves forward, what do you see as the best ways to ensure the active participation of older people and ensure that their voices are heard and their views included? Thank you.
Bueno, muchas gracias.
Many thanks for that statement. We have 20 minutes and 7 speakers. I ask of you, please, that you get to the heart of your statement. Now I give the floor to Ispela Kosir, the representative of Slovenia and member of the Bureau. Thank you.
Thank you, Madam Chair. At the outset, allow me to thank distinguished panelists for their presentations and invaluable inputs into this discussion. The COVID-19 pandemic presented a disproportionate threat to the lives, rights, and well-being of older persons and caused unprecedented suffering. The pandemic exposed the impediments to the full enjoyment of human rights by older persons. To provide support and alleviate the challenges older persons face, as well as to support their active role, Slovenia introduced several measures and allow me to share just a few. In response to the challenges of demographic change, Slovenia has in place an active aging strategy. The strategy is based on the concept of active and healthy aging. It emphasizes activity and creativity in all life periods, concern for health and intergenerational cooperation and solidarity. In times of lockdowns, access to digital technologies has become essential for maintaining social and active life and to access essential and other information. Ensuring digital literacy for older persons is thus critical. In this respect, let me mention our national intergenerational project called Symbioza, which focuses on pairing young and older persons to improve older persons' digital skills in view of providing lifelong learning. To facilitate and enable older persons to live independently in their home environment for as long as possible, a program called Older Persons for Older Persons is implemented under the auspices of the Association of Pensioners of Slovenia. Within this program, older volunteers visit older persons in their home surrounding and provide them with needed assistance, services, and support, including socializing. In response to specific impacts of the COVID-19 pandemic, the government provided additional financial solidarity support to the retired older persons with the lowest income. To alleviate the impacts of lockdown and prevent social isolation, older persons are contacted through telephone calls, SMS messages, and online platforms. Delivery of packages, food, and medicines are ensured, and when needed, donations of food and protective equipment are provided. To facilitate their active lifestyle during lockdowns, TV programs which guided physical exercise for older persons were broadcasted. Older persons were also given priority in our vaccination efforts. Madam Chair, Slovenia is among the 146 countries that have expressed their support for the Secretary General's policy brief, providing recommendations to strengthen protection of human rights of older persons. The working paper prepared by the OHCHR should also be the basis for our further discussions. Stronger protection and promotion of human rights and dignity of older persons, including through stronger legal framework, needs to become part of paradigm shift in our recovery efforts. We need to build back more inclusive, equal, age-friendly, and resilient society to fulfill our promise to leave no one behind. Thank you.
Muchísimas gracias.
Many thanks indeed to Isabella. I now give the floor to Older Women's Network Europe. Elizabeth Isklater, you have the floor.
Thank you, Madam Chair. As a result of the global responses to the pandemic, older women have been particularly affected, as identified by the Secretary General in his policy statement last year. We have seen evidence of older women being denied access to health and social care, with hospital and general practitioner services curtailed, and older women too frightened to seek medical help for non-COVID conditions. We have seen the right to family life disregarded. Older women, who are the majority of nursing home residents, were kept like prisoners in their rooms with very little human contact, and their carers lacked adequate personal protective equipment. We have seen the increase of reported violence and abuse when couples remained isolated in their own homes for weeks on end, simply because of their age. We have seen an increase in the number of widows, resulting for many in loneliness, isolation, and poverty. Increased reliance on information and access to services online has excluded those without broadband coverage, ICT equipment, or the skills to use it. As one Scottish older woman commented last year, do not assume that just because one part of the island has broadband, we all do. A UN Convention to protect the rights of older people will ensure age discrimination is prohibited in the law. It will deliver services to uphold our dignity and empower our individual potential. In the light of our experiences prior to and during this last year, it is time to stop talking and start drafting. Claudia Mahler, we look forward to your future report on older women. And I ask you, how should member states, civil society and others ensure the voice and contributions of older women are heard and our skills and experience utilized? As the majority of older people, we older women must be able to exercise our right to participate in public life and be part of the post-pandemic solutions. Thank you. Too quick.
Muchas gracias, señora Esclata.
Thank you very much to you, Madam Sclater. We now give the floor to Help Italy, Emilia Romano.
Good morning, and thank you for this opportunity. I'll talk on behalf of HelpAge Italy, member of the Global Network of HelpAge International, and member of GAROP, the Global Alliance of the Rights of Older People. As you have all said today, one of the biggest scandals of COVID-19 was the high number of deaths of older people living in care homes. It has been reiterated several times here today how many fundamental rights were denied to older people during the pandemic. And it happened dramatically to the most at risk, those who live in care homes. Within this structure, older people were denied many rights, including the right to life, the right to a dignified death, the right to health, and the right to quality care and support, including the possibility to maintain closeness with their loved ones. This is something that happened in Italy and elsewhere during the first wave of COVID-19, but that continues to happen now in our country more than 1 year later. The full respect of the rights of older people in care homes could have prevented deaths during the emergency and prevented great suffering, fear, abandonment, and loneliness. For this reason, HelpAge Italy is piloting a safeguarding framework based on the rights of older persons to prevent, detect, and manage malpractice, mistreatment, or abuse, including in emergency situations such as an epidemic. A framework like this, to be really effective, should take into consideration all the relevant rights. However, as you know, existing human rights frameworks provide fragmented and inconsistent coverage of the human rights of older people. So it is really time to start drafting a UN convention to guide and inspire care and support providers to design, develop, and provide better rights-based services for older people, now and in the future. Service providers and organizations that supports them need a clear and unique guide to work well and to guarantee older persons' human rights. Thank you very much.
Agradezco.
I'm deeply thankful to Ms. Emilia Romano. I now give the floor to the Dominican Republic. Jose Garcia Ramirez, you have the floor. Many thanks. It would seem that there is a problem with communication with the representative of the DR. We could perhaps save time and move to El Salvador to Ms. Oranio Morales. You have the floor.
Muchas gracias.
Many thanks. To you, Madam Chairwoman. We are grateful to the panelists for the information that they've shared with us and for the statements made. We think it's clear that it's necessary to ensure full respect for the human rights of older persons and ensure their dignity. We recognize at the same time that as countries we still have major challenges to overcome. Against that backdrop, we underscore the importance of strengthening the institutions that reach out to that specific population stratum. We would bear in mind that there is a wealth of different experience to take on board. We'd like to ask panelists what they think is most important when it comes to the implementation of public policies which mainstream the issue of aging. And what must we bear in mind when tackling policies which strengthen institutions to ensure that they can uphold the rights of older persons, making them a priority? There is no doubt that we believe that a convention would be an important roadmap to follow. and we endorse the appeal made for the establishment of such a universal instrument. However, at the same time, we'd like to take this opportunity to urge the Latin American region to continue to ratify the Inter-American Convention as its instrument, a roadmap that we already have in force, a roadmap that can guide all of the countries in this region. Many thanks indeed.
Muchas gracias.
Many thanks to you. I now give the floor to the National Institution of Human Rights of India, Dr. Taichi. You have the floor. Diashi, excuse me. You have the floor.
Thank you, Madam Chairperson. Thank you for giving me an opportunity to make my submission on behalf of NHRC India. Madam Chairperson, the COVID-19 pandemic has brought unprecedented challenges to humanity and posed a disproportionate threat to the health, life, and other rights of the older persons. We fully agree with the United Nations policy brief released in April 2020 on the impact of COVID-19 on older persons, that the COVID-19 recovery process is an opportunity to set the stage for a more inclusive, equitable, and age-friendly society anchored in human rights and guided by the 2030 Agenda for Sustainable Development to leave no one behind. In India, older persons are approximately 135 million at present. That is around 10% of the total population of the country, and are estimated to go up to 20% by 2050. According to the data released by the Government of India, about 53% of the COVID-19 victims were older persons. There has also been an increase in the cases of abuse and discrimination against them during this time of pandemic. Studies show that the mandatory self-isolation to curb the spread of the virus has made the older persons more vulnerable to mental health issues such as loneliness, depression, and anxiety. The National Human Rights Commission of India, being deeply concerned for protection of human rights of people, especially the marginalized and vulnerable sections of the society, issued 12 advisories to the union and state governments in the context of COVID-19. The Advisory for Protection of Rights of Older Persons, issued on 5th November 2020, advised the government to provide one, access to medical services, doorstep delivery to those having severe mobility issues, and to ensure treatment of their non-COVID ailments in hospitals without any hindrance. Second, timely disbursement of pensions. Third, employment assistance, job search assistance, vocational guidance and training, provision of universal social security benefits to be provided to the older persons. Fourth, access to food, doorstep delivery arrangements for food and other essentials to the needy older persons. Then fifth, access to social support. Government was asked to ensure that helplines are equipped to address the issues of elderly abuse, and quick and adequate measures are taken against the perpetrators. Awareness and sensitization programs to be conducted on the issues of older persons. Sixth, access to assistive devices. Government should ensure availability of aids and appliances needed by older persons, and also the repairs and maintenance services of assistive equipment at the district level. Seventh, elderly in institutions and shelter homes, old age homes and daycare institutions to be regularly sanitized and social distancing to be ensured. Older persons who are homeless or are isolated by a family must be identified and accommodated in shelter homes. PPE, masks, sanitizers, and other essential goods to be readily made available to the caregivers also. The concerned union ministries and the states and Union Territories of India were also asked by the NHRC India to submit the action taken reports on the Human Rights Advisory. And I'm happy to say that most of them have reportedly complied with it.
Please.
Thank you.
Please, muchísimas gracias.
Many thanks indeed. Thank you very much. The last speaker is Akamish Palet Mitam. We have one state left. We have one state left with problems to connect, and that was the Dominican Republic. We're going to wait and look at whether they can come back to us later. Cameroon.
Bueno.
Okay. While we prepare the NGO from Cameroon, I'm now going to once again try to give the floor to Ms. Roque and Ms. Mala to comment on their last block of questions before we try to connect to Cameroon and the Dominican Republic. Briefers, you have the floor.
The floor. In the case of time, I try to answer two questions. The first one is how can we ensure the participation of civil society organization, older persons in a treaty body process, and I would therefore I would recommend to use already the existing system to raise awareness to the human rights of older persons. For example, make a parallel report to the Committee on Economic, Social and Cultural Rights on the issue of healthcare, or get into the interactive dialogue with myself or the Special Rapporteur on the rights of health. And if we get a convention, we need to ensure that there is a concise treaty body system acknowledged, and therefore we need to report. We also need reports from civil society organizations, and ensure that you already have national discussions on different issues to raise awareness that this is a violation of human rights. I also would like to thank and acknowledge that I get such a positive feedback for my work. And the last thing I would like to answer is how can older women get more participation in the discussions? Therefore, I would really look forward to get more data on older women, especially in the cause of violence at home, violence in care homes, and domestic violence, because what we have witnessed during, not only during the pandemic, but it was very evident in the pandemic that we are lacking data, that there is a kind of age cap in these statistics, and therefore older women are not included in this discussion. Make this aware, raise awareness to this issue, and also bring the issue of the human rights of older persons to other fora, for example, to the Commission of the Status of Women, or to other commissions, and get included in interactive dialogues with me, for example, or with other special rapporteurs and with the treaty bodies. Thank you so much for your questions, and I'm really looking forward to more fruitful discussions.
Muchas gracias.
Many thanks to you. I don't know whether Ms. Roque wishes to make any comments. We're coming to the end of this morning's session. Do you wish to add anything, Ms. Roque? Thank you, Madam Chair. I just want to quickly say that I agree with what was said by the independent expert. The United Nations has a fundamental role to play because all independent experts, rapporteurs of the United Nations, must tackle the issue of aging. Where the CEDAW is concerned, there's recommendation 27, which has been in place for 8 or 9 years, but there's not sufficient knowledge about that recommendation. There's no assessment with what's going on with the implementation of that recommendations. And so we don't really know where things stand. When it comes to the Inter-American Convention on the Rights of Older Persons, it has two very important articles. Article 32, which is awareness raising, that's vital awareness raising by the whole of society about older persons and their rights. We're talking here about awareness raising and training, and there's Article 8 of this convention, which is the right of older persons to participate. Here, states have an obligation to promote the participation of older persons. Consequently, it would seem to me that a universal convention must also take all of that into account. The Latin American region has national councils in place and federal councils in place for older persons. However, the voices of older persons are not often heard, and we have heard that persons with disability are also often sidelined, but we're working on that, and at the same time many governments of the Latin American region might be trying to make progress, but nothing can be done for older persons without older persons. They need to be actively taken into account when it comes to measures being made for them. We need to and make sure that the issue of aging is a cross-cutting one. I'd like to thank and congratulate you, Madam Chair, ministers, expert Claudia Mahler, all the experts of civil society, because what they've done has been very important indeed. Thank you. Many thanks to you, Ms. Roque. Many thanks to expert Mahler. There's one state left. I would ask interpreters to just exercise a little bit more patience. The Dominican Republic is now available. Dominican Republic, you have the floor. Dominican Republic? Jose Garcia Ramirez, Dominican Republic, are you available? It would seem that the problems we had remain. There are connection problems. We have run out of the time we had for this general debate. I'd just like to convey my sincere thanks to our distinguished panelists, to the Minister of Portugal, to Secretary Roque, the independent expert Mahler. All of your contributions have been highly valuable indeed, as have your suggestions and your advice. The participation of all of you, member states, members of civil society, thank you. All of your input has been very rich indeed. I think that this has been a very constructive exchange of views that makes us stronger as we forge ahead. Before adjourning the meeting, I'd just like to remind you that at 3 p.m. this afternoon, the working group will continue with its interactive debate on agenda item 6. And this is monitoring and follow-up of Resolution 7552 on the priorities of the 17th session on standard setting. To connect to this afternoon's sessions, please use the link that you used for this session. The virtual meeting room will open at 2 p.m. I now adjourn this meeting of the high-level panel on COVID-19 of the OEWG. Thank you to all of you. The meeting is adjourned.